Welcome to Bringing Better Health to Life, brought to you by Conway Medical Center. My guest is Dr. Peter Bondy with Carolina Bay's ENT, and he is an otolaryngologist. And I think that's probably the best place to start to explain what that means.
Well, otolaryngology is ear, nose, and throat. Oto is ear. Actually, rhino used to be the original term, otorhinolaryngology. Rhino is nose, and laryngos is larynx or voice box. So we handle problems of the ears, the nose, the throat.
As in all of the above, huh?
Right.
Let's talk about where you were before you came here.
Well, I went to medical school in Minneapolis, Minnesota. I attended there on an Armed Forces Health Profession Scholarship. So as a result of that, I ended up coming into the Navy on active duty and just turned it into a career 23 years later. I spent the vast majority of that time at the Naval Medical Center in Portsmouth and worked my way up. I was faculty, I had trained there, and then I became assistant chairman and then chairman, and ended up teaching residents for 18 years. So.
But you actually went from one beach to the other, so it wasn't such a bad move, was it, Dr. Bondy?
Nope. My wife likes it. She grew up in Virginia Beach, so.
And we're glad she likes it because we want to keep you around. I want you to tell me a little bit about some of the new things in sinus surgery. I'm sure a lot has happened even since you graduated and finished medical school to what's happening today.
Right. In fact, when I started residency, we were still going into the nose, just going through external incisions around the eyes and sometimes up underneath the cheek to get into the sinuses. Then when I was in my residency, we started using endoscopes, but we were still creating pretty big holes in the sinuses. And you know, you've probably heard people talk about the 6 feet of packing they had in their nose. Well, we haven't used that since I was in residency. We've progressively gone to smaller and smaller openings, taking out less and less tissue, trying to just recreate the natural openings. And most recently, within the past couple of years, a newer technology called balloon sinuplasty has come along. And what we do there is very similar to how a cardiologist opens up the wall of an artery in the heart that's been blocked. We open up the natural openings just using a high pressure balloon. And really, people who have undergone this have been able to go back to work the same day or the next day. It's not for everyone. Sometimes we have to remove polyps or growths in the nose, and we can't necessarily use the balloon technology for that. But for many sinus surgeries, we can do what's called minimally invasive surgery, where we go in with endoscopes and the balloons.
And obviously you do this so that they have a better breathing situation, less allergy issues?
Well, it can help with their breathing, although the sinus passages aren't necessarily part of the breathing in and out through the nose. That sometimes needs to be corrected with the septoplasty or other types of nasal surgery to improve the airway of the nose. Opening up the sinuses just helps alleviate the chronic sinus symptoms of facial pain, pressure, sometimes infections, things like that. People who have allergies are more prone to sinus infections, so we need to treat the allergies as well as sometimes open up the sinus passages.
What else has been really new in your practice that, just like the sinuplasty, what else has been new and innovative that amazes even you?
Well, in terms of allergy therapy, something that's new that has actually been practiced in Europe for decades is called sublingual immunotherapy. And it is something that I'm hoping to introduce into our practice sometime in the next 1 to 2 years. ENT surgeons have been using it more recently, and it's become a very nice way of treating younger children who don't want to get shots. There's a fairly safe profile with sublingual therapy, and what we do is similar to giving shot therapy, we test people, see what they're allergic to, and then we give them what they're allergic to. Only in sublingual therapy, it's in the form of drops that are given underneath the tongue. And over the course of months to a year, it can help improve their allergy symptoms. My own daughter has been on it for a couple of years now, and I feel very comfortable giving them.
Dr. Bondy, we're going to take a little break here, but when we come back, we're going to talk about more issues pertaining to otolaryngology, and I hope you'll stay with us.
The Conway Medical Center website provides visitors with a comprehensive resource for their health and wellness inquiries. From our homepage, just click onto Search Health Topics for direct access to the HealthWise knowledge base, where you'll find over 5,000 topics about health conditions, medical tests and procedures, medications, support groups, and everyday health and wellness issues. At Conway Medical Center, we know that better informed patients make better health decisions.
For over 50 years, it's been our mission at Garden City Furniture to offer our customers quality home furnishings at an excellent value and to provide personalized service that is second to none. You'll feel at home at Garden City Furniture on 17 Business in Garden City.
We're talking with Dr. Peter Bondy from Carolina Bay's ENT, and I'm just curious about some endocrine issues that you deal with and thyroid conditions. I'm sure you see a lot of those patients.
We do. We are one of the specialties that treats both thyroid and parathyroid disorders. We're a surgical specialty, so most of our dealing with them is if they need surgery. They are oftentimes referred from either the primary care physician or from the endocrinologist. And the nice thing is we have some newer technologies, particularly for the parathyroid diseases. There's a scan called a Sestamibi Scan that is a localizing study because most people, when they have problems with the parathyroid gland, have one of the 4 glands involved. So it helps us to hopefully do a quicker procedure, sometimes as little as 30 minutes to get that parathyroid that's affected out. And we usually go through fairly small incisions in the front of the neck. There are some newer technologies that will at times allow for even endoscopic approach, although the majority of patients really don't qualify for the endoscopic approach to their thyroid or parathyroid glands.
Dr. Bondy, most of the people that I've known who have had endocrine problems have seen a ton of doctors or have had tons of tests before they ever got to that. How does someone know that they're having endocrine issues?
It depends on whether it's the thyroid or the parathyroid that's affected. Parathyroid disease usually shows up as either kidney stones or bony aches and pains. Women and men may show signs of osteoporosis as the calcium is leached out of their bone. And so oftentimes it's picked up on routine laboratory test where someone gets a test for, say, a physical exam and they're noted to have a high calcium level. They then undergo further testing, and that's what leads them to the diagnosis of what's called primary hyperparathyroidism. With thyroid disease, symptoms of hyperthyroid can oftentimes be symptoms such as palpitations, weight loss, feeling of heat intolerance. Hypothyroidism is just the reverse. You may get weight gain, you may have feelings of cold intolerance, your hair may become stiff and brittle, and those can be associated with either nodules that cause problems, or you can just have a general enlargement of the gland. Not all thyroid or parathyroid problems need to be addressed by an ENT surgeon, but we certainly are called in when there's a nodule or there's a suspected what's called a parathyroid adenoma.
You were mentioning allergies earlier, and there's so many allergies in this area. We know that we're sadly one of the #1 places in the nation with allergy illnesses. What other ENT allergy-related illnesses do you treat?
Well, my philosophy is certainly there's a number of people who can treat allergies, and although we certainly treat allergies, I think we serve patients best when we treat patients who have other ENT-related diseases. For instance, if they have nasal polyps, if they have chronic sinus disease, if they have a deviated nasal septum that makes it difficult for them to breathe through their nose, and they have allergies. Those are the types of patients that I am targeting to hopefully get them treated for their allergies. There are people with food allergies that can be very difficult to treat. There are people with a number of different allergens who don't have other nasal or ENT-related symptoms, and those patients are certainly well treated by going to a general allergist.
But you specifically like to see people who are ENT-related, other issues?
Correct.
To you, after all these years of being out of school, retired from the one career and now into another, what has been one of the most amazing things in your practice We know that all practices have changed, and even cardiologists have said the same thing. Things have changed totally from when they were in school. What's the one thing that you're really blown away by that you never thought you'd see?
I think the technology advances. For instance, going back to the balloon sinuplasty. When I started, we were opening up sinus cavities very wide, and in reality, probably not doing those patients a very good service. And now to be able to take a patient who has chronic sinus symptoms, open up their cavities with a balloon, and then send them back to work either the next day or a few days later, that's very rewarding. We also have just the advances in surgical equipment that allows us to do our job better. We have better diagnostic equipment in the office. Not everyone has it, but there are ultrasound machines that you can use. There are mini CT scans that can be utilized in ENT offices to diagnose sinus disease. There's a capability to do fine needle aspirates of nodules of the thyroid and other neck masses. And again, not every ENT office handles them, but they certainly are options that can help with diagnosis.
Dr. Peter Bondy, thank you so much for being with us. Great information, great free advice for our viewers today. Thank you so much.
Thank you. My pleasure.
Bringing better health to life, brought to you by Conway Medical Center.